Tonight, our Minnesota House is debating a bill that would give you, the people, more time to pay off medical debt and offer more protection from aggressive debt collection tactics. We're looking at health care yet again. John Croman has more on what's being called the Minnesota Debt Fairness Act.
A cancer diagnosis shouldn't translate to debt for life, but that's how it is for some patients.
I'm a 4-time cancer survivor, and a lot of times it feels like I'm in a constant cycle of medical debt. And I have so many situations where I've had to choose between like buying groceries or paying a full medical bill or putting gas in my car.
Jen Schultz is a public relations professional and adjunct professor at Concordia University, and among those who rallied in the rotunda to talk about the burdens of medical debt.
Oncology appointments, scans, ultrasounds, biopsies, medication, treatment, and so on.
The rally featured a coalition of faith leaders, unions, and patient groups pressing lawmakers to bring some relief.
I had to quit my job when my toddler was diagnosed with leukemia and required around-the-clock care. My family went from a 2-income family to having a mountain of medical bills.
The lead sponsor in the Senate, Liz Bolden, is also a hospital nurse.
I take care of patients in a hospital, and far too often, the patients that I am taking care of in the hospital, while they should be focusing on care and rest and recovery, far too often they are worried and nervous and overwhelmed because of the debt that they are accruing while they're in the hospital.
Her bill would bar medical providers from denying care due to unpaid medical debt. It would ban the practice of transferring a dead patient's debt to a surviving spouse, and it would bar providers from reporting unpaid medical debt to credit bureaus.
We're protecting property tax refunds and eliminating the practice of revenue recapture for medical debt so that hospitals and ambulance services cannot take your tax returns anymore.
Most of the pushback against this bill has been from the credit industry and hospital groups who say they already write off a lot of medical debt in Minnesota. They warn of the unintended consequences of changing the rules. At the Capitol, John Croman, KARE 11 News.